Okay, I'm Marj Berthold, and this is Meghan O'Rourke. I'm going to start off with what I'm going to say. Choices for care out of UVM, Department of at Burlington, and in Vermont, and then Waterbury, Department of Mental Health, Human Services, Mental Health Services, Health Services, and Aging Services, out of their office and buildings and businesses and structures, some of their employees that they were gonna look into about when I was put down outside their businesses and in their businesses. They didn't do it, or they might, or if they did do it, I don't have to wait a couple of years to know about it, and I think that's too long to wait. They put me down and ran me into the ground and talked inhumane and cruel. And I told them about how cruel they were, and they said they'd look into it, and then there was somebody that got in touch with me, or an email said, "Oh, I'll get in touch with you." And then they says, "No, we did everything right." And then they says, "We're taking you off the choices for care." And I says, "Well, I thought you were going to look into the people not treating me well and running me into the ground and public outside your office and in your office. The people ran me down, and the people that worked for it, outside their office and in their office, they ran me down, and the people that worked for them, and they didn't do it. Or if they did, they didn't tell me about it. And that's part of, if you are going to look into it, you should tell the person about it that says something. Mm-hmm. You don't wait 10 years and say, well, by the way, we did it 10 years ago. Mm-hmm. And then also, primary care had for the last, I don't know, maybe almost 12 years, that wasn't doing, didn't want to do it the way, have help the way I needed for my own health care and life. In Burlington, I just felt, but I did something to help I talked to someone to help me about it this morning. I felt better, but the health care, they said, but I couldn't make decisions for my life, and I couldn't have help that was helpful. I couldn't talk the communication. I couldn't have it in a way that would work, and that was very distressing. And then the Vermont mental health system for the 50 states, and Vermont, solving it all alone for that, I can't do it. And the people that expect it and put pressure on it, I just can't. And so do you want to say something?
So you don't want to be responsible for fixing it all yourself?
No, and I can't, especially other people's behavior. That's not fair. Like if they want to blame me for something that someone else does, like I'm responsible for what I do, but like if somebody else does something and they want to put pressure on me to do something about it, I can't. And it's not fair to not expect them to fix it if they're going to, or even if they're not going to, not blame me for it, because I can't do anything about someone else's behavior. I can only do something about mine. And then especially if it's not working, their behavior, they should try to encourage them to do what works. And then also for primary care, they should encourage people that work there to let people make their own decisions for their life that would help them. And then I couldn't sleep all last night because I didn't know if it was going to get better. But when I talked to this person today, I can see how it can get better, and I have hopes for it to get better. Sometimes I have to figure out what I can do that will help. Sometimes, you can't do something that helps, but a lot of times you can.
So you had an experience where you were working with people that were supposed to be helping you, and you experienced that as ridiculing, like they treated you poorly.
That's right. And I also experienced that many years in the Vermont mental health system, and in the Vermont mental health system, you know, Vermont mental health system, I finally stopped it because basically I didn't want them to put pressure on me to expect me to fix it all and then to not talk to me in a humane way and not work out the misunderstandings, and I thought it was so unfair.
Yeah. And you have an idea around people offer help, but it's not necessarily help you need. They're offering you the help that they are willing to give, and it's not what you need. Is that right?
That is correct. And they, a lot of times, are very forceful and pushy about it by saying, you have to have this help.
Yeah.
And overbearing. And it's just, and oppressive and abusive and inhumane cruelty and psychological torture. I went, and you know, and well, especially at Vermont State Hospital, when I was spent 22 years, that is not there. The Department of Mental Health and Aging and Human Services and Mental Health and Health Services is there and now, but I haven't seen it because
it's changed. They got rid of the state hospital. You spent a long time there. And
well, right, but I haven't been back to Waterbury. There's no reason to go back, and I hadn't had a particular desire to go back because, I mean, pretty much the hospital was pretty much what I knew, and I didn't want to go back to the hospital, but then there wasn't anything else to really go back for, and any function of the Vermont mental health system, I just don't want to go back for, just because I'm burned out. And for the last 43 years, I tried to have things get better, and I don't know if I don't think they ever can get better, more better than what they are, because I'm just literally burned out. I don't know if I'll ever recover. And then also, I don't know if, and it feels like it's too late for so much to get better. Maybe some things can get better, but it will not be the same as if they had done it at the time.
Yeah.
And it's just like, I'm very discouraged with it, but with the primary care, I have some help for that. I can have some primary care that will help. Because when I talk to this person, it helps so much today.
Yeah, you have an idea that when misunderstandings go on for too long, it's nearly impossible to correct them. Is that right?
That's right, but the primary care I need for health care, and I have some hope, and I really believe that and know that it can get better, because after I talk to this person, they let me know that it could, and it really helped a lot. But I had to think, you know, I thought all night long, well, who can help me? And then I thought of the person that could help me, and they did.
Yeah.
But sometimes I've thought of things all night, and I couldn't think of something that could help. Yeah. And a lot of times, if it's, you know, like a lot of misunderstandings after a real long time, you know, I don't know, if they can't get better, or if they do, they won't be the same. But see, healthcare has to get better, because I need healthcare. And so when I talked to this person that it could get better healthcare, I felt so much better, because I need health care, and this person said I could have health care that would help, and I felt so much better.
You advocated, you thought about what you needed, and you advocated for yourself.
And this person was helpful to me.
That's awesome. That's great.
And you know, this person was very, very, very helpful, and she was, and I told her that I thanked her for her help.
Yeah.
And then she thanked me.
That's awesome. I mean, you have done such a good job of advocating for yourself and others throughout the years around this issue. I hear you saying you can't solve it all on your own, but do you feel like you're solving it with other people?
I'm solving some of it.
Yeah.
I mean, what I'm saying is some of it, like I can't, I mean, like all of it, no one can do it all. Mm-hmm. But some of it with people, but then some of it that's gone on so long, anything that would be solved would not be the same as if they'd done it right at the day that the misunderstanding happened. If you wait about 50 years, it's not going to be the same, is it?
Yeah.
Well, is it?
No, it'd be amazing if people could fix things before they even become a problem.
Well, that's right. That's what I'm saying.
Yeah.
And, you know, that's what I'm saying. And,
Is there anything else that you want to say today?
well, are you going to send it to that person?
Do you want to say anything more on the show before we?
Yeah, I do. But were you going to send it to that person?
Yeah.
You know who I mean?
Yep.
Or do you?
Yeah, we'll send this program to people so that they can look at it.
Well, will it be besides?
Yep.
Well,
all set.
Well, okay. Well, the person I mentioned.
Yep.
But is it going to be besides her?
We'll talk about it, but I think after the show, let's finish up.
Well, right. I don't think we want it on the show.
Yeah. So, is there anything more that you want folks who are watching?
I said I don't think we want it on the show. What do you think?
I think that is absolutely. We don't need to have it on the show.
Well, what I'm saying is I want to continue to have hope that things will get better because, I mean, there's so much that needs to get better because I've been through so much.
Yeah.
And I'm just...
It's generous of you to share your experience with others, Marj. Thank you.
Well, I don't know. Do you have any other ideas of how things can get better?
I think, you know, that advocating for yourself and understanding what you need and letting people know, and you've been really good at that, helping people, finding the people that you can connect with to help tell your story is really useful.
Can you come to the coffee hour at Grandway sometime? Mm-hmm. You don't know when?
I don't know when, but do you want to end up the show?
Well, I just wanted to say one other thing. Would you make sure that, I mean, like, wouldn't you want it at a time I was going to be there?
Yeah, if I come to Grandway for coffee hour, we'll do it together.
Well, I mean, you don't know my schedule without...
Oh, we'll talk about it ahead of time. We'll make a plan together.
Okay. I just want things to get better, but do you think I should say anything more on that, or do you think we should stop? What do you think?
You could just say thanks for watching.
Thanks for watching, everybody. I hope I didn't have much sleep. I didn't have any sleep last night, so, I think I did okay. What do you think?
I think you did great. Thanks, Marj.